Hey there and welcome. So you've recently had surgery for Peyronie's disease, and you're probably sitting there thinking, okay, what happens now? Well, you are in exactly the right place. In this explainer, we are going to walk you through a super clear step-by-step guide for your recovery. We're going to turn all those questions into a solid, confident plan for healing. Okay, let's just dive right in. The whole point here is simple. We want to give you a clear roadmap for the days and weeks ahead. We'll cover what you should expect, the key things you need to do, and just as importantly, when it's time to pick up the phone and get some help. So let's get started. First things first, let's talk about what happens right after your procedure. Just knowing what's normal and what's not is probably the biggest first step to having a stress-free recovery. Right after surgery, you're going to experience a few things that might seem a little, alarming, but I promise you, they are totally normal. It is very common to see some bruising and swelling, maybe for the first couple of weeks. You might also notice a little bit of bleeding, maybe some burning when you pee, or even some painful erections. The most important thing to know is that this is all an expected part of the healing process, and it will all get better over time. Now let's really zero in on those first 48 hours. This is such a critical window for your recovery, and a few key moves right here at the beginning will set you up for the absolute best possible start. Okay, I really cannot say this enough. For the first day or two, ice is going to be your absolute best friend. Seriously. It is the single most effective tool you have for keeping that swelling and discomfort down, and it makes a huge difference in how you feel. But we gotta be smart about it, right? Never, ever apply ice directly to your skin. Always wrap it in a towel first. You're going to want to apply it on and off, so think 20 minutes on, then take a break. And just repeat that as often as you can for the first 24 to 48 hours. This simple little routine is so key. So on the actual day of your surgery, the anesthesia is still working its way out of your system, so safety is everything. That means absolutely no driving. And you know what? It's probably best to avoid making any big life decisions either. Just rest, keep your activity to a minimum, and whatever you do, keep that surgical dressing on and keep it dry. All right, so now let's zoom out and look at the bigger picture, the first 6 weeks. I want you to think of this as a journey, and it's a journey with really clear milestones that are going to guide you right back to your normal routine. This timeline here basically lays out the whole path forward. After 48 hours, you can finally take your first shower. Now, for those of you with a graft, you'll start some specific meds around week 1 and then begin some gentle stretching exercises at week 2. And then comes the big one. At 6 weeks, most of the major restrictions are lifted. See? It's a progressive journey. Now, during these 6 weeks, there are 3 golden rules. These are non-negotiable if you want to heal properly. Number 1, no sexual activity. Number 2, no baths or hot tubs. And number 3, no swimming. Following these is just essential to give your body the uninterrupted time it needs to heal up the right way. So you're probably asking, well, what can I do? You can gradually start exercising again once that swelling has gone down. And what should you avoid? Well, the big 3 we just talked about, plus any kind of straining when you go to the bathroom. And don't worry, we'll get to how to manage that in just a moment. Okay, quick but important note here, specifically for those of you who had a grafting procedure. This is a crucial extra step. Starting 2 weeks after your surgery, you're going to begin a routine of gently stretching the penis outwards. You got to do this twice a day, every day for 4 weeks to make sure that graft is successful. Okay, let's kind of pull all of the daily stuff together now. These are the proactive things you can be doing every single day to really support your body's healing process. When it comes to managing pain, the approach is pretty straightforward. Over-the-counter stuff like ibuprofen or Tylenol should be all you need. And the really good news is that those strong narcotic painkillers, they're not usually necessary for this kind of recovery. Remember how we said to avoid straining? Here's exactly how you do it. Stay really hydrated, drink plenty of water. Up your fiber with lots of fruits and vegetables. And listen, don't be a hero. Use an over-the-counter stool softener if you need it. This all helps prevent any extra pressure on the surgical site. Okay, this next section is incredibly important. Knowing what's normal is great, but it is just as vital to know the warning signs. The things that mean you should stop what you're doing, pick up the phone, and call your doctor. It is so crucial to be on the lookout for these specific signs. A fever over 101 degrees Fahrenheit. Any signs of infection like redness, pus, or swelling getting worse at the incision. Not being able to urinate for more than 8 hours, or really bad pain that your medication just isn't touching. Any of those mean it's time to call your doctor's office. Don't wait. And let's be crystal clear about the difference between a concern and a flat-out emergency. If you experience something severe, like bleeding that you cannot control, that is not a wait-and-see situation. That's a call 911 or get to the nearest ER immediately situation.
At the end of the day, your recovery is a journey. It has a clear path. It's not a race to the finish line. The steps we've gone over today are your guide. So, I'm going to leave you with a question to think about. What's one positive, proactive step that you can take for your healing today?